Hey, my name is Dr. Augustine. Today we're going to be speaking about heart rate variability, also known as HRV. Why do we do this testing is because it's very helpful to determine how a person's nervous system is working. The test is an EKG-based test, so it's actually looking at heart function, but most importantly, it shows how the autonomic nervous system is doing. Autonomic nervous system is the automatic side of your brain that runs and regulates everything inside. So we have Nathan strapped in with a Bluetooth wireless strap that's going to generate an EKG signal for us that we're going to record over here into our computer. We're going to do two procedures today. The orthostatic test, which is the first one, he's going to lay down and stand up, and that's going to see where the autonomic nervous system's at, heart function. It'll give us a really accurate health marker and some other information as well, such as liver function and adrenal function and those sorts of things. The second test is called the Valsalva test, where he holds his breath with pressure bearing down and deep breathing, and that provokes the autonomic nervous system to see how well it can react and respond to what's going on inside of his body. Okay, are you ready?
Yeah, let's do it.
So Nathan has a chest strap here that's generating the EKG signal. It's a wireless Bluetooth connecting over here to my laptop, if you can see this. And so go ahead and lay on your back, Nathan.
Cool.
Good. Take a couple deep breaths just to kind of let your body know that you're laying down and you're relaxing. Good. Now hit start. And so in a few seconds you'll hear from the computer this bling, and that just means to stand up to your feet.
Cool.
Okay, so Nathan, now we're going to have you stand up. Now we're going to have you sit down. So now this part, you're going to take a deep breath in, hold your breath, and bear down like a bowel movement kind of pressure for about 15, 20 seconds.
Okay.
Okay, deep breath in. Hold your breath, pressure. Just like that. Keep pressing like that. Almost there. Good. Relax. Gives you a few minutes or a few seconds to recover. And now we're going to have you do some deep breathing. So deep breath in, really deep in. Pause at the top for 2 seconds. Good. And then all the way out, really deep out. Pause at the bottom for 2 seconds. And deep breath in again. Pause. And then out. Good. Just like that. Keep going. Done.
Cool.
Awesome. So Nathan, we just finished the test. Now we're going to actually look at the results. The first test result we're going to look at is the orthostatic test. That's where you were laying down and you stood up. Okay? So the first thing we see is we like to look at your autonomic nervous system. Your sympathetic nervous system is too high. The stress side of your nervous system is too high. But the parasympathetic is surprisingly low for such a young guy. You're in a moderate to severe nerve system position with your autonomic nervous system. Heart function is pretty bumpy, hence the variability side of it. The more bumpy, the better. The more variability, the better. Heart rate laying down was 81, and you stood up and went up to an 89. That's kind of high for a young guy like yourself. So that's what I'm saying, probably some stress going on. So now we're going to move to the second page of it. Second page gives you a health marker. Now, the top left corner is the best health you can be. The bottom right corner is the worst health you can be. And you're closer towards the bottom right corner, but also top to bottom on this test is adrenal function. So your adrenals are like second from the bottom. You're pretty low. So you're having too much stress. Your body is in a stressful state. We need to strengthen your adrenals, so you're going to need some nutrition for that. Left to right is full body physiology, so it really does give us a good look at the deepest level at your full body physiology. Also, what we notice is you have a laying down number that's called tension index and a standing up number of tension index. Both of those should be less than 100. Yours are high, they're above. The laying down was 233, the standing up was 281, so that basically says you have some liver dysfunction going on. Not liver cancer, but unhappy liver. And when we did some other testing, as you know, from our Menla scan, which there's a video, I did a video on Menla scan, we saw some liver issues there, plus we did the cell exercise, the energy testing. Liver was also uncomfortable, it was tender, sensitive. We always see people have health problems when their parasympathetic is too low. In your case, you're down to a -2, so you're right on the border of moderate to severe nerve system problems. That's why we do biocranial, and also we would charge your brain with the cell exercise, the energy as well.
I see.
So 2 great things there. I have videos on both those, so check that out on my YouTube channel. So the next test is the Valsalva test, and this is designed to provoke your autonomic nervous system to see how well it can react and respond. And there's 3 levels there. There's good nervous system response, there is moderate nerve system problems, and there's severe nerve system problems. You scored in the moderate nerve system problem zone there. The conclusion page says that there is significant decreased level of adaptability. So that's in those adrenals. So you definitely need to support your adrenals. And you start supporting your adrenals with more of a stimulatory energy type of adrenal support, like desiccated adrenal. Rhodiola ginseng, another really good one for you. With this, it says the beginning stages of some chronic problems. And that I would guess, without looking further, probably some digestive issues as well, because you have huge parasympathetic nerve supply in your digestive tract. And it said slight increased stress level, because your sympathetic it wasn't up too high, but it was up there a little bit. So would you agree? Do you have some stress going on?
I do have some stress going on.
Okay.
It's not too high yet, so that's good.
So that's the conclusion from both of these tests. They really give us a great picture at heart function and autonomic nervous system function, because that's what creates health and wellness in your body. What Nathan needs to do, we need to give him some supplementation. He needs to support his adrenals with adrenal desiccated. Number 2, I definitely would recommend rhodiola and ginseng to really start to rebuild, repair, and get his adrenal glands to heal. He'll find that he has more energy. I would also suggest reducing stress. If you can get a little bit extra sleep, that might be good too. Get some sunshine, that would help really calm you a bit more. We need to improve your autonomic nervous system. So how would we do that? We would do biocranial. We would actually jumpstart and improve brain function. We have a video on that as well. We would also be charging up his organ systems, because he showed that his liver wasn't so happy, so we charge up his liver. We would charge up probably his digestive tract and certainly your brain. And Nathan would do very, very well. He would heal up, not only heal up, but he would feel dramatically better in his performance, and his exercise, his lifting, and all of the things he's trying to do to strengthen his body would get much better. So if you like what you saw today, please like this video and subscribe to my YouTube channel. I'm also on Instagram, TikTok, and Facebook. My name is Dr. Augustine from Head to Wellness. Have a great day.